Good afternoon, everyone. We from Shaheed Hospital, we are organizing a webinar on the topic management of neurotoxic snakebite in collaboration with CMC Vellore. So, being in a resource limited setup like a Shaheed Hospital, we as a junior doctors, we are facing some kind of issues. We are getting so many snakebite cases in our locality area. So we are diagnosing cases, we are doing the initial management part, but few cases are getting worsen and we need to intervene specialty measures like ventilator settings and all. So we are having some problems in the management guidelines and all. So we are trying to, we want to collaborate with CMC Vellore and we want some expertise in this topic. So we are organizing this webinar. The speakers will be starting with Dr. Jana, Dr. Saibal Jana, Chief Medical Officer in Shaheed Hospital. He'll be speaking to us regarding the snakebite status in our hospital setup. Next, our speaker is Dr. Shahid. He'll be doing a case presentation which we get in Shaheed Hospital. Then our next speaker will be Dr. Anand Zakaria, Professor of General Medicine, CMC Vellore. He'll be speaking about management of neurotoxic snakebite, focusing on krait bite. Next, our next speaker will be Dr. Benila, Professor of Critical Care from CMC Vellore. She'll be speaking about ventilator management of neurotoxic snakebite. Then our next speaker is Dr. GB John. He is a physician in Chinchpada Christian Hospital, Maharashtra. He'll be speaking about his experience of neurotoxic snakebite from Chinchpada. So I'll request Dr. Jana sir to proceed with his talk. Thank you. Okay.
Welcome everybody. I am Dr. Jana from Shaheed Hospital, Dalli, Rajhara. It is situated in central India in Chattisgarh. This hospital is built by the iron ore workers, those who are working in the iron ore mines, and this is run by the workers of the mines. So this is the hospital that we are catering the tribal and the most marginal people of central India, especially in Chhattisgarh. So we are facing so many problems, and one problem is the snake bite. Snake bite, we are getting at least 50 to 60 patients every year, and also we are facing some problem to give the treatment because the maximum patient come to us late. That is very one of the things that because that we are seeing that the culture of our area, this is very important because the snake bite, still the patients did not come to us directly after bite to us. This is the big problem. Always they call the Baigas, that means the traditional healers, and when the traditional healers will fail, then they came to us that this is the problem we are facing, and sometimes the dead body come to us. That is also a problem. So that's very big problem because we did the time lapse between the bite and the proper treatment. This is the big problem to us. Second problem is that we are seeing that, especially in case of viper bites, we are seeing that they 3-4 years back, we are seeing that the response of the anti-venom in viper bites, sometimes we need 10 vials, sometimes it is sufficient. But nowadays we are seeing that not 10 vials, the 20 to 30 vials it is needed to treat the viper bite. This is one of the big problem for us. Also, the community how to educate the community, because the culture of the community is that they are always in faith of the traditional healers, and they are not only in a healer, their role in every activity of the community. That's why that they have the very deep rooted belief in that system. So this is also it's a problem, though we are interested to start. We are doing the community education, and also to educate the students also, they how what to do when there will be any snake bite. Also that snake bite, how to prevent the snake bite, and how to keep the snake for our sake, that is a environmental sake, that is also very important. So this is my humble request to the panelists, that they will teach us, they will give us their experience about the management of the neurotoxic snake bites. I hope that their teaching will help us to manage the our snake bite patients in our area. Okay, thank you.
A good day to everyone. Myself, Dr. Shahid, junior doctor working at Shaheed Hospital, Dalli Rajhara in Chattisgarh. Today, I'll be presenting a case of a neurotoxic snake bite. It is one of the several cases of snake bites that we have dealt in our hospital recently within the past 1 month. And this one case is particularly very interesting and important at the same time in understanding not only the medical aspects of a neurotoxic snake bite, but also the cultural and socioeconomic aspects of the society that we are working in, that plays a big role and has a big effect on the outcome and the management of such similar cases. So I'll go on to my presentation. This is about a 24-year-old female, Riteshwari, who is from Salhe. She's a housemaker and from a farming family. And she has completed graduation, that is BA in sociology, and her husband is an electrician working in a mining company, and they've been married for 3 years. And this is Salhe, her beautiful village where Riteshwari lives. As you can see, it is a farming village with lots of forest areas and water bodies around side. And she was brought into our casualty at around 2 p.m. in an unconscious state. And her further history was obtained from her husband. And as per her husband, she had gone to bed as usual the previous day at around 10 p.m. and woke up at around 2 a.m. with complaints of sudden onset abdominal pain, which was progressively worsening over the next few hours and was followed by multiple episodes of vomiting at around 6 a.m. later in the morning. And later she developed throat pain with difficulty in swallowing. And at around 10 a.m., she found difficulty in talking and was followed by chest heaviness at around 11 a.m. And she had been undergoing rituals and indigenous treatment from the local healers at her own house all this while. And by around 12 p.m., she started feeling dizziness and fell unconscious. And it was only then that she was taken to our hospital, which is around 12 kilometers from her village. As you can see, this is Riteshwari, this is when she had come to our emergency department. Our staff and team is working hardly on resuscitating her. And her husband claims to have found a black snake with white stripes at their house early in the morning that day. And there was no other history of fever, diarrhea, or any other associated symptoms recently, and no other significant past history. This is the picture of the snake, not actually from Riteshwari's house, but this is actually a picture from one of our another patients who was also recently had come with similar complaints. And this was a photo of the snake they had clicked from their house and had shown to us on their mobile. At arrival at around 2 p.m., she was unconscious. She was unresponsive with a GCS of 3/15 and she was taking gasping breaths. And her vitals on arrival was with a pulse rate of 88 beats per minute and a blood pressure of 100/60, and her SpO2 was 35% in room air. She was immediately given bag and mask ventilation and was soon intubated, and she was given intermittent positive pressure ventilation with bag and ET tube. And she soon developed complete descending neuromuscular paralysis and lost all her respiratory efforts in around 10 minutes after the intubation. This is Riteshwari, as you can see, and she has been intubated soon after admission, and she's undergoing ventilation now. And on physical examination at the time of admission, as I've mentioned, her vitals were as follows: pulse rate with 88, BP of 100 over 60, and SpO2 of 35%. And general physical examination, she was a febrile, showed no pallor, icterus, cyanosis, clubbing, lymphadenopathy, or edema. And head to foot examination showed no bite marks or any wound marks. And on intubation, some glottic edema was seen with pooling of secretions in the posterior pharyngeal wall. And on respiratory examination, she was taking gasping breaths, and the air entry was bilaterally equal with clear chest, and her first and second heart sounds were heard, and with no other added sounds or murmur. Her abdomen was soft, non-distended, with no organomegaly or hepatosplenomegaly. She was in comatose state with flaccid paralysis of all four limbs, and Dalli phenomenon was absent, with absent bilateral deep tendon reflexes and flexor plantar reflex. She was soon started on volume controlled mechanical ventilation, and in view of the clinical presentation consistent with a neurotoxic snake bite, she was started on 10 vials of polyvalent anti-snake venom, IV fluids, neostigmine, calcium gluconate, and broad spectrum antibiotics. And patient showed improvement in vitals by the evening that day, with some movement of the lower limbs and the upper limbs. And on day 2, she started responding to our commands with gestures, and ventilator settings were weaned off gradually, and she was showing a steady improvement in response. And by the afternoon of the next day, on day 2, that's around 23 to 24 hours after intubation, she developed intolerance to the ET tube and was self-extubated. She was maintained on non-rebreather mask and was gradually tapered off oxygen over the next day. And she gradually showed improvement in muscle power and started ambulating on day 3 of admission. And ptosis was the last to recover, which persisted partially to almost the 5th day following the bite. This, as you can see, is Riteshwari. She was extubated and she is on non-rebreather mask. And this is our Chief Medical Officer, Dr. Jana, examining her. And this is the next day when she was taken off oxygen, and this is her husband feeding her, and she is able to swallow. She is able to deglute food and water on her own with some support which she requires. And the following day, she started showing a steady response. She started sitting up on her own. And on the next day following that, she started gradually walking on her own and gradually developed muscle power in all her limbs. And she was discharged on the 6th day of admission, and on she was well and good at admission. And on follow-up 2 weeks later, she had no complaints nor any abnormality in any systemic examination, and her neurology was normal with no deficit and a normal higher mental function. And the only thing to note is that she still has an incompletely healed ulcer over her right foot, which was caused by the attempt by the priest or the local healer to suck out the poison from the foot by his or her mouth, and on the day of the bite. And that was the only medical condition that she still has left even up to 1 month after her bite. This is the picture of her foot, which is showing a non-healed ulcer. This is a very interesting case, that this condition was not caused by the bite or by the snake itself, but it was caused by the cultural aspects that followed the bite at her home. This is Riteshwari's home. They live in a joint family, and this, as you can see, the wooden door which is seen straight there is probably the way through which the snake has entered their house. And the curtained room which is seen to the left, to the right, is the room in which she was sleeping. So this is probably as you can see, the door has a lot of gaps through which many reptiles or small rodents can easily enter and exit through her house. And this is the picture of this is the picture of a typical house in any Chhattisgarhi village if you visit. That's the doors or the windows are of similar picture. And that is the end of my presentation, but I would also like to talk a few words about how the timeline of how Riteshwari's timeline went from the time of bite to the arrival of the hospital. And I would like to talk beyond her symptoms and complaints. What actually happened was that, like any Chhattisgarhi village house, usually a snake bite is followed by some panic. And this panic is not something that leads to the hospital by an ambulance, but it is a panic that goes by a call to the priest or the local healer. This local healer, as usual, had come to Riteshwari's house at around 6 a.m. in the morning, and he had started performing his rituals, claiming that he could make her all right. And initially, he fed her with some local herbs and some local herbal medicines, and the priest himself ate those medicines by himself. And after around half an hour to 1 hour of rituals and pujas, he claimed to suck out the poison from her foot. And after some attempt of sucking the poison out, the husband, all this history is, we got all this history from her own husband, who claims that the poison was sucked out from her foot along with the herbal medicines which the patient had eaten. So this actually made them trust the priest more, because the medicine which had gone through her mouth had come out there through her foot. So he claimed that the poison had come out along with the herbal medicine. But it is of very interesting thing that the herbal medicine was eaten by the priest himself in the beginning. And after some time, the priest claimed that the poison has come out of her whole body, except in the foot, which a small amount is left in the foot, which is of no danger, and I can treat it by some more time of rituals. And after some more time, when she started feeling dizzy and started becoming drowsy, the priest claimed that he needed to check whether her nerves were okay, and otherwise there is no problem with the poison. So in order to test the nerve function, as what he claims, that they burnt a few agarbatis, incense sticks, and have burnt her hands and chest part with the incense sticks, with burnt incense sticks, which caused sudden jerky movements of her body. And the priest claims that yes, her nerves are okay, so we are going in the right direction. And more after that, going further, again she went severely unconscious, severely drowsy. And that's when the priest said that now you can take her to the hospital, because for my puja to work, she needs some more energy. So for the energy, you can go to the hospital. They will give you some IV fluids or some glucose or some IV drips, which will give her enough energy to sustain my puja, and that will make her all right. So in the meanwhile, I'll continue the puja at your house, and you can take her to the hospital for the trip. So even when the patient had been taken to the hospital by the bystanders, they were still under the impression that this is something that could be made all right by the puja at home, and that she just needed some IV drips or some energy from the hospital. So this is not a very rare or a very uncommon practice. It is a fairly common practice, because most of the patients which we receive here with the snake bite usually come at a very delayed stage, and the majority of the reason they've mentioned is due to the local practices and the local healers, which tend to delay their attempt to come to the hospital. And this understanding is a very important aspect, which is a very pivotal aspect in recognizing the gravity of the problem in the society which we are working in. So with this, I would like to conclude my presentation, and thank you for your time.
Thank you, every speakers, for your time. And I again, Dr. Preeti, to conclude this webinar. I would like to summarize the thing. First, being in a centrally located area, in a resource limited area setup, we in a Shaheed Hospital, we get so many unusual cases here. But in the past 2-3 months, we got so many snake bite cases, because it was rainy season. People used to go to farm for their agriculture purpose, and we are after, as Shahid has already mentioned, we get so many delayed cases. We are getting cases after local healers are discharging them, or they are referring them to our hospital. So we as a junior doctor here, we are able to diagnose the case, and we started the initial management part. We started on ASV and other symptomatic managements. But while doing this specialist care, like in ventilator support, and we needed help, so I contacted to Dr. Anand Zakaria, and he responded promptly and has helped me a lot to arrange this webinar. I thank him a lot. Then I would like to thank our speakers, Dr. Binila and Dr. Zibi, for their participation in this webinar and their resources. And even Dr. GB has volunteered to guide us and help us during any further help in the ventilator support or anything we want any specialist guidance during the management of our patient. Then I would like to thank the whole CMC Vellore team for organizing this webinar, and we are expecting more webinars like this to help us deal with the topics we are lacking guidance by being there in a resource limited setup. So thank you so much for all. Thank you.
Thank you, everybody, especially Dr. Anand, Dr. GB, Dr. Binina, for your valuable knowledge which we got from you. That is very, I think Shahid Hospital team will treat the snake bites, especially the neurotoxic snake bites properly. That is very essential, because that we are getting the snake bites very number of snake bites we are getting. I think this kind of knowledge from institution like CMC Vellore, it will very helpful to us to manage the patients properly and very affectionately also. So I think this kind of webinar, our junior doctors, they arrange it in near future also, not only in snake bites and also in other aspects of the medicine and surgery. Also, we can arrange the webinar, and we will get support from the CMC Vellore. Thank you very much for your great support.